Guess what, y'all? I'm back. Didn't I tell y'all I was coming back? It's Mental Health Awareness Month. It's every May of every year. Y'all not going to get away with me not having a Mental Health Awareness Month video, so I'm doing this one. You may have seen some of my other videos from last year with Mental Health Awareness Month, Minority Mental Health Awareness Month, which is in July, PTSD Awareness Day, which is June 27th, Mental Illness Awareness Week, which is the first week of October. There's so much on the calendar devoted to mental health awareness that should tell you how much of a crisis this is. And today I'm geeked because I have someone who's also awesome, dipped in fabulous. Her name is Dr. Paula Saunders-Newman. She's right next door to where I am. I'm in Chapel Hill. She's in Durham. So I wanted to bring on a therapist for a couple of different reasons. That way we can answer some questions and bust some myths and do some different things surrounding mental illness. Dr. Newman is a child therapist. She works with adults as it pertains to parents, but mainly children and family services is what she provides. So I'm really geeked to have her here today. Hey, Dr. Newman.
Hi.
I'm really, really glad to have her here today. And if you haven't noticed, she's Black. Mental illness does affect Black people, and quite often we don't seek treatment and we don't see people who look like us. So that's where cultural appropriate care comes in. So I'm going to get started. I have some questions for her, and y'all just leave me some questions in the comment section. You can send me an email. My email information is out there, and we're just going to get started with this business. So, Dr. Newman, why is mental health important?
The less stress we have, the less we have to deal with depression and anxiety and worry. The healthier we are, the more likely it is that we will focus on our dreams and do the things that we really enjoy in life. And the better we are in relationships with our friends and our family. And it just makes for a better life when we are mentally healthy.
That makes sense. Okay, so my next question is, y'all know I did not memorize all these questions. So my next question is, what is a mental illness?
It's a wide range of conditions that affect your behavior, may affect your thinking, may affect your moods. And so there are over 200 classified mental illnesses, and again, it affects your thinking and your behavior and your moods. And some mental illnesses with some people can be very, very mild, and you may not even pick up on the fact that you have one, or it can be moderate or severe.
Okay. And approximately how many Americans suffer with a mental illness, and why is it such a crisis?
In any given year, 60 million Americans suffer with a mental illness. And it's a crisis because I think we are just overwhelmed. I just think we are piling too much on ourselves, that we have so much pressure and so much stress, and we just create stressful lives, and we don't know how to kind of relax and pull back and say no and find really good coping mechanisms for the stresses that we incur in life. And so I think that's why it's such a crisis.
And that basically boils down to 1 in 4 adults and 1 in 5 children, which is a lot. And guess what? Those are the numbers that we know of. Think about how many people are running around here undiagnosed. You hear me joke a lot of times and say you're going to catch the unmedicated. RJ, you keep pissing me off. But, think about a lot of the people who aren't on meds and who may need them. What exactly is a mental illness, and where does it come from?
Mental illness comes from environmental stress. I just said that, and from genetic factors. People can hear people say, that because it runs in my family, or my mother had it, my grandmother had this. And so chemical imbalances are a combination of things. And so I just some things from person to person, we don't exactly know all the time, where it comes from.
So can anybody have a mental illness, or is it just exclusive to certain races or certain people?
Oh, no. Any races, any cultures can have mental illness. Not all, choose to deal with it in the same way, meaning psychotherapy or medications, but, mental illness occurs in all cultures.
And it's funny you should say that, because for some reason, Black folks have this belief that mental illnesses either aren't real or they're just white people problems. Mm-hmm. And I guess that's a lot of times because we don't understand what a mental illness is, and really don't get the connection between everyday life and small happenings, small red flags that just will explode or increase in its severity over time, and we don't realize that's what's budding in us. So we figure, it's not. This is just life. This has nothing to do with a sickness. but that's a different story. Can a person have more than one mental illness at a time, and how is that possible?
Yes. Usually depression and anxiety present themselves together, and so you become depressed, and then you become anxious about going places and doing things, and then on top of all that, sometimes especially when people don't want to go and get a medication, they self-medicate with alcohol or drugs, and so then you have a dual diagnosis, a co-occurring diagnosis that involves drugs and substances on top of depression and anxiety, because we need to figure out how we're going to deal with these mood changes that we're having or whatever, or how to deal with these panicky feelings that we're having. And so we will then again sometimes abuse substances.
And one compounds the other. That makes sense. What do you say to the people who believe that mentally ill people should just be locked away in an institution?
I think that's fear. I think we fear the unknown. As I said before, we really don't know sometimes where it comes from, and we don't know if we can catch it, and we don't know if it's going to happen to us. And so out of sight, out of mind. And so, being afraid of it, sometimes we cause a person with that mentality to say, okay, can we just lock them all up?
And I think what also has to do with that traditionally is media influences. We see people on TV not functioning well with mental illnesses, but instead being very delirious, psychotic, violent, dangerous, running down the street butt naked, talking to themselves, chasing, invisible people with hatchets. And that's not people who are living with mental illnesses realistically. Psychosis is a very small part of what mental illnesses are. And I think if we can get away from watching TV so much and get to know people, then we can begin to move away from some of those ideals. So
it's true.
Mentally ill people can live independently in society.
Yes.
Okay, now what about therapy? Why do therapists always start off, we watch, see, she's laughing because she knows what I'm about to say. We see it, they sit on the couch and the first thing they do is go back to childhood. Why are they always bringing up childhood and bringing up old stuff?
Because it just depends on the therapist theoretical foundation. You're taught about Freud, and you're taught about Gestalt, and you're taught about different theorists, and then you have to decide as a clinician which theorist you want to follow. And so you choose a model, and sometimes if people choose the psychoanalytic model, they will go with Freud believed in whatever happened in your childhood, impacts your mental health today. And so lots of people do that, but just based on how insurances pay now, the preference for insurance companies is that therapists use brief solution-focused therapy and just say, okay, what are your symptoms? And let's figure out a plan to work on the symptoms and, deal with the here and now. But again, with your first appointment with a therapist, they are going to ask about childhood traumas, childhood relationships, because they have to diagnose you. And so you need to cover all around in order to get a really good diagnosis.
Okay. I remember my first therapy session, and I hated that woman. I think I walked in there and I said, if you did not read my file in detail, don't come talking to me. I know you got 10,000 patients, but if you just looked at the file and only saw one or two sentences, I don't need anybody to tell me about myself who has not read extensively about what's going on in my past. So, yeah.
And sometimes with that, I don't know that therapists all the time want to trust somebody else's work. And so, if you go to see more than one therapist, and yes, you may have the paperwork from the other therapist, but sometimes people don't trust that people did a really good job in getting the story or whatever. So sometimes people will ask and it's awful to have to tell the story again and again and again. I get that.
Okay. Now, I want to talk about some of these pharmaceutical commercials, because I hear the side effects, and I just want to know, Dr. Newman, why... If these are supposed to be medications, then why do they have such dire side effects? I mean, because now my guess is pharmaceutical companies don't want to be sued anymore, so they just go ahead and tell you what the side effects are. But some of them, they're just so extreme. Like, you're going to have irritable bowel syndrome, thoughts of suicide. You might wake up dead and have blood coming out of your eyes. And you're thinking, like, this is supposed to help people. I don't understand. So if they're supposed to help, why are the side effects so dire?
And I'm sure that pharmacists, scientists are working to find medications that have less side effects. But I just think anytime that you're dealing with chemicals, there are going to be side effects. And all of our bodies are different. And so, different people are going to experience different medications in a different way. And I don't think we can get around it, because I think if there was a way to get around it, that we would. So I just don't think, there's a way around it.
That brings me to something really important. And you mentioned self-medicating before, but I also think of the people who say, oh, well, just pray it away. How does culture and religion factor in? Especially, have to pick on black folks, I'm sorry. And I don't do that, just because I'm self-hating or anything. But mental illness is still very taboo in the black community, and no matter how much we see on TV, how many advances are being made, finally, the good thing coming out of these crazy reality shows are more and more black families going to therapy, but still, it's still something that's just far off, distant in our minds, and that we really don't want to discuss or talk about. Black people, and I remember an episode of Girlfriends. I forget the name of the actress, and I think it was Golden. I don't know her name on the show, but she said, black people don't go to therapy, black people go to church. And you say?
And that made me think about, I don't know how many people watch Empire, but it's a young man who is Andre is experiencing, I guess, bipolar disorder. And there was an episode when I guess he was having an episode, and the dad was saying to the therapist, they were showing when he was a child or when he was in college, and the therapist said that he had a mental illness, and Lucius said, don't ever say that word in regards to my son. And it made me think about how much when people die, we never say that the person is dead. We say they passed away, they transitioned, and just certain words we don't want to hear. And that's the thing that happens in the African American culture, is we don't want to hear mental illness. Again, it's because we don't understand and we're afraid, and we experience it more than some other cultures, just because of the history of oppression, being brought here as slaves, and that still continues to trickle down. You say, okay, well, slavery's been over for years and hundreds of years, and why haven't we gotten away from that? But there are just some things that go along with day-to-day oppression and discrimination and things that just happen to you that cause you to have lots and lots of stress that can kind of, be one of the environmental factors that result in a mental illness. And we don't want to go to see a therapist because, we're told not to tell people your business, but especially don't tell white people your business. And so that's something that we still pass down in our culture or whatever. So we're afraid. We're afraid of medication because of the Tuskegee experiment, where African American men were given the syphilis, and so for research or whatever. And so, we think about all of those things, and we pass these stories down generation after generation. And so it inhibits our culture, people in our culture, from going to seek help.
And, I think about how we have, as Dr. Newman alluded to, an innate distrust of the medical community, especially white clinicians. And it's just not medical. You think the word social services, and people think, okay, that's just some white lady coming to take away my kids. And it's not just us. There's low level of treatment, especially in culturally competent treatment in the Asian community, Native American, Hispanic. For years, we've seen on TV people who had mental illnesses either were dangerous, or it was some white woman in her mid-40s going through a divorce because her husband cheated on her. And then when you sit on the couch, who are they speaking to? A white male. So a lot of times we just don't want to, not only not want people in our business, but we really don't want to seek help from people who we think aren't qualified to help us. So tell us about your practice. You're a child family therapist, and you're out of Durham, North Carolina.
Yes, I have a practice in Durham, and I see children from ages 6 to 21, and so I don't see adults unless we're talking about parenting stuff. And I do lots of play therapy and art therapy, and really enjoy working with younger kids. I do see teens also. But seeing a lot of ADHD and a lot of conduct disorder, and don't see many kids who are suffering with major depressive disorder. Some, but not many. And again, with the lots of ADHD diagnosing, I'm thinking that, we're overwhelmed as a society. We have so much coming at us, and, we're giving kids a label and a diagnosis, but I just think that all of us have some of these same symptoms. Mm-hmm. And the thing that makes something a mental illness is whether or not it starts to impact your daily living. Mm-hmm. And so I can be sad about something and not be able to kind of get up and go for a couple of days, but I can kind of bounce back and get to my job. When it becomes a problem is when you can't bounce back. Mm-hmm. and you can't move forward, and it impacts your being able to kind of take care of yourself and move forward. And so it's something to always keep in mind as to whether or not I really have an illness, because I can be depressed, but if it doesn't stop me from getting done the things that I need to get done, then I may not go and see someone, and I may not get a diagnosis.
Are you taking any new clients?
Yes, I have a small practice because I do have an 8 to 5, and so my practice is in the evenings and on weekends. I see clients, and
that's really important, because a lot of times people are at work.
Yes.
And after work, they may not be able to see a therapist. Right. You're already hard pressed to find family practice doctors who will see people like at the health department late on Wednesdays, or maybe 9 to 1 on Saturdays. But It's good when you have a therapist who's available after hours. And as I always say, I'm not going to make this video long as Roots. So I just want to thank Dr. Paula Saunders-Newman for stopping by. Hopefully we've given you some information about mental health that you did not know before, and maybe encourage you to go out, do your own research, do some volunteer work, get to know people and not illnesses for Mental Health Awareness Month, and maybe bust some myths and some stereotypes as well. So leave me any comments that you have or any questions, and I'll leave Dr. Newman's information in the description box as well. That's it. Happy Mental Health Awareness Month and wellness wishes. I'll holler at y'all in the next video.